UK Healthcare Community Connection is sponsored by UK Healthcare.
Welcome back. We are joined by Dr. Omar El-Kawagi from the UK Markey Cancer Center with the latest on available treatment for thyroid cancer.
Welcome, doctor. And first off, if you would, give us an overview of what thyroid cancer is and what sort of symptoms people may experience.
Yeah, well, thank you for having me. So I think to be able to answer that question, I have to tell you a little bit about what the thyroid is. That's a very common thing that I get asked. So the thyroid is a butterfly-shaped gland that sits in the base of the neck. That's why I wear my thyroid pin.
I was going to say similar to the pin.
Similar to the pin. And its job is to make something called thyroid hormone. Thyroid hormone makes a whole lot of functions in our body. It helps control our heart rate, our metabolism, weight, blood pressure. So it's a pretty critical little organ. Thyroid cancer is basically a tumor of thyroid cells. So those are thyroid cells that have multiplied at a fast rate, creating a tumor that can occasionally spread outside of the thyroid and into other tissues. Most thyroid cancers are actually start out as what's called a thyroid nodule. A thyroid nodule is a mass on the thyroid gland. And thyroid nodules are usually detected what we call incidentally, meaning that a lot of times people don't have symptoms, but rather they go in to see their provider for another reason. Say, for example, they had an x-ray or some sort of CAT scan, and it found this incidental thyroid nodule. And so most people don't really have a lot of symptoms. But the reason that I bring this up is it's pretty critical that if you or your provider do find one of these nodules on, say, an imaging test or even by an examination, a physical examination, it's pretty critical to discuss with your provider, could this be a thyroid cancer or not? The good news is the vast majority of these thyroid nodules are not cancer. They're benign. And we can work with patients to help distinguish which ones are benign and which ones are cancerous.
What role does diet play into the function of a thyroid and risk for cancer?
Yeah, so that's a good question. We know for sure that diet plays a very important role with the function of the thyroid. Whether or not there's a link towards risk of cancer is still yet to be sort of discovered and looked at. We know that iodine, which is a critical element that we find in our diets, plays a very large role in how the thyroid works. The thyroid relies on iodine as a type of fuel, and that's how it makes the hormone that it makes. And so in places where there's deficiency of iodine, people are not getting enough iodine in their diet, that can cause problems with the thyroid. Now, fortunately, in our diets, iodine is found in multiple sources. It's in iodized salt and other sources, so we don't deal with that too much. We know for a fact that when it comes to thyroid cancer risk, there seems to be a correlation, so two things that are related but not necessarily caused, with obesity rates. And so we know that keeping a healthy diet and active lifestyle is an important factor in preventing thyroid cancer.
Interesting. Well, very good information, doctor. We are out of time, but we appreciate you coming in, and I learned a whole lot this morning, didn't you?
Yes, and is there can you feel around your thyroid?
You can actually. You can feel your thyroid gland yourself. It's just at the lower part of your neck.
All right, so it's a little too high.
So, yeah, similar to where my thigh might sit at the very lower base. And if you sort of fan out your fingers, you'll feel a little bit of soft tissue there, thinking of a butterfly shape.
All right.
I think I'm good.
I think I am too. I'm going to be feeling my neck all morning now. Doc, thank you so much. We appreciate you.
Thanks for having me.
And we'll be right back with the final half hour after the break.